Hi, everyone. Welcome to today's session on how you can become a doctor and how you can choose the right university. We're going to be here with Dr. Fasten Goma, who's the Dean of the School of Medicine at the University of Zambia. Now, by default, I want to indicate that everyone is muted. So if anyone wants to ask a question or if you have a comment to make, then all you have to do is click on the chat icon with a question mark on your upper right-hand corner of your GoToWebinar screen, and the chat window will appear on the lower right. What you can do is type your question or your comment and click on the send button, and we'll be able to answer your questions towards the end of the session. But meanwhile, we'll have Dr. Goma discuss some interesting tips on how you can choose the right university and which university is for you. Now, I'd like to introduce you to Dr. Fasten Goma, who is currently the Dean of the School of Medicine at the University of Zambia, as we've already discussed. He also has many other laurels to his name. He's a medical doctor with a MSc Cardiorespiratory Physiology from the University College of London, a PhD in Cardiovascular Science from the University of Leeds. He's also studied international public health at University of Alabama at Birmingham and tobacco dependency treatment at University of Toronto. He's also an elected international member of the National Academy of Medicine. He's also an active member of the African Heart Network and the World Heart Federation, and is also the founding president for the Zambia Heart and Stroke Foundation. Dr. Goma, thank you for joining us today. How are you today? I'm just going to hand over the control of this one to the expert and let him do all the talking for you. Dr. Goma, over to you.
Thank you very much. It's my pleasure to join you this afternoon, and welcome to our audience. I can see that a lot have joined us and here really to share on the tips that we would want to give to them on how to not only become a good doctor, but really on how to choose a good university to learn medicine from. I think your introduction has been very thorough. Just to try and update that curriculum vitae in that I have served my term as dean, and so now I am back to my department as professor of the department and not really as dean of the School of Medicine. So probably after my stint at being dean and looking at admissions to the university and to the School of Medicine, I think this is the first time, this is a good time for us to discuss this matter and to see if those who are still to get into medical school can get a little more advice on how to choose a medical school for themselves. Well, I just want to try and give you a little rundown of Zambia and where we are. Well, Zambia is one of the countries in central southern Africa. I think we are more towards the south than the central of Africa. We are really in the heart of Africa. We consider ourselves to be in the center of the southern region of Africa. And if you have looked at the map, you will see that we are actually landlocked, meaning that we have land surrounding us through and through. We are not bordering any sea as such. We are bordered by 9 countries, and so we consider that a blessing to us in that we are well linked to our neighbors. And because of that, I think we have a very central role to play in the history, geography, and economics of this region of Africa. We are a very big country, 752,000 kilometers squared, but with a population of only 17 million estimated as it is now. And so we have a very big country, but a very low population density. Most of the people are concentrated in cities, We have about 36% of all the population actually in cities. We still have 64% in rural areas. Our per capita GDP is on the lower side at 1,300 US dollars per capita. Well, we have just moved, I think, in the socioeconomic ranking from low middle from low income country to a low middle income country. That's where Zambia is. We have 4 medical schools as it is now, 2 public schools and 2 private schools. The University of Zambia School of Medicine is the oldest of them all, having started in 1968. And so we are just about to celebrate our Golden Jubilee this year. Actually, we are celebrating it in July. We'll be clocking 50 years of existence. The others are much younger than us. And so we take pride in being the leaders, being the elder brother, offering them the shoulder that they need, and offering them that hand that guides and the hand that gives them strength to keep moving on. And so we are glad really to take that role. And this afternoon, I think we are together trying to say, how do you choose a university to which you will commit your life, so to say? Because I think the choice of where you go as a medical student ultimately writes your destiny. And in all that you do thereafter, they will always consider you as a product of that university. I've just put on the screen now the picture of the Victoria Falls, one of the 7 wonders of the world, found in the southern part of Zambia. Really, this is a natural beauty. And if you think of coming to Zambia, please do not leave out a visit to the Victoria Falls. It's always a good break from hardcore science. And so we are hoping that that has whetted your appetite for thinking about this region of the world. All right, so I think we need to get started to go into the subject of our discussion this evening. And really, I would want to say that as a university, everyone must pride in excellence when it comes to education. And so I have entitled my first slide, Training for Excellence in Medicine. And I hope that all those who are listening to me are actually thinking of just doing that you want to come out of this medical school to be an excellent doctor and to leave a mark on this earth that, yes, you have done something worth doing for mankind. So to train for excellence, you actually need to know the university that you will be going to. And the first thing you want to know is how the World Federation of Medical Education rates your institution. Now it's quite easy to rate this institution. And by looking at the criteria provided by the World Federation for Medical Education, you're actually able to have a good insight of how good an institution it is that you are thinking of going to. And then you can rate these institutions one against the other and choose wisely, so to say. Now, the World Federation of Medical Education has set standards for medical education. It has, first of all, defined standards for a particular institution. It has defined standards for national bodies, how the national regulators of medical bodies, of medical education institutions are supposed to rate these institutions. But they also have state standards for the regions. And I think that is good because it's not really one size fits all when it comes to medicine. Each region has its own peculiarities. And within those peculiar circumstances, you'd want to focus your medicine or you'd want to focus your training in such a way that the doctors coming out of your institution are well geared to face the challenges that are within the environment that they are going to exist in. And so to some extent, I think we respect the the World Federation for Medical Education, and the standards that are put out have actually been endorsed by the World Health Organization and the World Medical Association. And the World Federation for Medical Education has really one aim, and their aim is to enhance the quality of medical education worldwide with promotion of the highest scientific and ethical standards in medical education. And so with that aim in mind, I think they have set ground on which we all have to try and operate to ensure that there is excellence in what is being offered. What are these standards that the World Federation of Medical Education is insisting on? First of all, they have said that every institution ought to have a mission and well set objectives. So I think as you think of going to a university, look up their mission. What is it that they intend to do in molding a being such as you from just a naive student to a well-baked health practitioner, one worth being called a doctor? What is their mission? How do they intend to fulfill that mission? And how do they get you to where you want to be? So what are the set objectives? I think it's very, very clear that you ask those questions. And then you would want to look at the education program. What is their curriculum like? Okay. Who is it comparable to? Now, you will see that there are several curricular types. At the University of Zambia School of Medicine, we run a traditional curriculum. A traditional curriculum is one which separates preclinical sciences from clinical sciences. It has had its own critiques, okay, its own criticisms. And I really think that based on that, you are able to see which way to go. So there are some which are still that behind, so to say, in curriculum development, in that they would want to separate preclinical sciences from clinical sciences. So you teach students in the classroom and in the lab the first 3-4 years, and after that they go into the clinical area for the latter part of their program. But there are more innovative programs now which are integrated. So from the time you get into your medical school, you are introduced to the clinical aspects of medical training. And so even as you learn your basic sciences, there are a lot of clinical components or clinical applications already put in there. And so you learn to integrate these sciences from the very foundation of your program. I would prefer such a program. However, as I said, there are many other varieties, that pit one program against the other. And each of them have their own strengths, and each of them have their own weaknesses. And some of these are addressed in the standards that follow. So that's the educational program. So be very clear exactly which program you want to follow and what program is being offered by that university. If you are happy with the type of program, get on with it, and please make the best out of that program. The other question that you'd want to ask really is how assessments of students are done at that particular university. Are students being assessed continuously, or are they being assessed in phases? How serious is this assessment taking place? Here, we really insist on continuous assessment, and we put a lot of weight towards that, because if a student performs poorly during the year, there's no way he is going to perform well at the end of year examinations. And so a student must continue to prove themselves throughout the academic year, and they must make sure that they exert themselves at the given assignments, and they must present themselves for the different types of examinations. these examinations would either be formative, or they may as well be summative. But in whatever way, it must be a system that fairly assesses the students and assists them in being students who are continually improving themselves as they go through the training program. The next thing you'd want to ask yourself is the type of students who go to this institution. I think it's very, very important that you choose an institution which you would be proud of yourself. And so see their selection criteria. Do they select good students, or do they select anybody? If they take anybody, then that institution does not have standards. But if there is a set criteria that makes sure that only meritorious students are accepted into the program, I think that is an institution to go to, because you'd want to be proud that you actually were selected for that institution, because that institution is well known for its standards. And so by you getting into that institution, the institution is acknowledging that you worked hard and you have qualifications which are worth telling the world about. And then you'd want to actually know about the loading of this institution. Okay, student staff ratio is very, very important. And so you don't want to go to an institution where there are a lot of students but very, very few lecturers. It means that the education is not good standard. You will not get the best out of that system. Make sure it's a system that has a good student lecturer ratio. And so as you go in, they will give you the needed attention. And so you will come out well-baked. The next standard that is set is that of the academic staff, the lecturers and the professors that they are in the institution. Are they really well-trained people who will be handling you? Which universities did they go to? What are their different qualifications? And how much research are they getting to do? Nowadays, there are a lot of search engines that you can use to try and search the different lecturers who are at this institution. So get into the institution, pick out the professors who say to be there, and put them on the search engines. The search engines will show you exactly what their academic achievements have been and how much respect they are getting in the academic world. And so as they become more visible, you know that your university will forever be visible, knowing that you also will be visible when you come out of this institution. I really think that that is a way to set one's career. And then you look at the educational resources. What sort of resources does this institution have? Now, this is very, very important, because medical education is about information, a lot of information. Unfortunately, in medicine, we are in a system where information changes and changes pretty fast. And so you need to always keep on the cutting edge to know what the truth is today, but always being aware that what we may say is true today may say to be false tomorrow. And what we are saying is false today may actually be said to be the truth tomorrow. And so every time we keep our eyes open, we keep reading, and we keep looking at discoveries. What is it that is being discovered, and how well is it fitting into the basics of what is known in science? And so where are the resources for you getting this information? So before you get into a university, find out, okay, do they have a good library? And nowadays, it's not only library that has, paper, as printed books, but we are looking here of libraries that have space where you can sit and access the internet, and where you can actually have access to the very latest journals, books, and all the necessary sites where you can get information, and information nicely packaged within the science field. And so it's very, very important. You ought to get to an institution that has that type of facilities. Okay? And so you ought to make a good choice before getting into a university. The next standard that is set before us is that of program evaluation. How well does a university evaluate its program? How often is that program evaluated? And are they really keeping up to date with what is going on in the changing medical world? If the answer is yes, then you have a choice. And you would also want to look at governance and administration. Okay, how well is this university governed? First of all, is look at the processes of registration and accreditation. In the land where they are operating, are they registered with the authorities within government? Are they accredited by the regulators? The different health professions, councils that are available, do they recognize this institution as a medical education training institution? And if they do, how do they rate it themselves? It's very, very important. And you look at the administration. How well is the institution being governed? Are they keeping to the academic years? Are the students, do the students know when they are in session and when they are off session and things like that? Very, very important. And then finally, we have a standard here about continuous renewal. How well is the university moving on towards renewing itself, making sure that there are new things happening at all times and it's not lagging behind, or it's not stagnating in its academic and research development. So these standards are very, very important. And I think as a potential student, you need to ask questions within these spheres. And if you are getting ticks against each of them, then you are a good person. And you are actually, you have a choice. Well, after you have assessed the institution itself, the next question that you'd want to ask is the environment within which this training program is going to take place. Okay, where is this institution stationed? Is it an environment that offers you space within which you are going to learn curricular and extra curricular dictates? And is it a stable environment? And I think this is where Zambia scores a first. Zambia is a very, very stable country, politically and socio-economically. And it actually, as I said, is nicely situated geographically. So everything actually is well placed for Zambia as a country. But really, we are talking here about a particular institution where you want to go and study. What type of environment is it set in? And how well behaved have the students been in the past? And so you would want to ask about history, of students rioting, or students boycotting class and doing all sorts of funny things. You'd want to find out why were those things happening. Okay, so when you're choosing an institution, you want to choose one which has shown an amount of stability, and an institution that is existing within an environment that encourages development, not only academically, but much more professionally, so to say. It teaches you how to interact with the public. It teaches you how to interact with the health system, and it teaches you how to interact with other members of the profession. So you need to really operate in an environment that has population health in mind, that in all that this institution is doing is fitting into the national mission, national vision of providing health care to its population, and providing that health care with equity, providing that health care with human rights in mind, and taking into consideration that public health is the most important aspect that ought to be offered by the general population. But knowing that for you to attend to these population needs, you actually need a very good mix of human resource. And so in the world, in the field, you are going to work with nurses, you are going to work with biomedical scientists, you are going to work with physiotherapists, you are going to work with environmental health scientists, and all those other professionals. They are crucial to the development of healthcare provision. And so if you are to work with them, then this training institution must be set in an environment where it encourages this efficient mixing of health professions from the word go. Ultimately, you want to get out of your medical school, get into a health system that will look at various outcomes. Most important are the health outcomes. Are you going to make a difference to how the health outcomes of the nation are looking? Are you going to make a difference in the system? Are you going to cause a general improvement in healthcare provision? If the answer is yes, you have an institution that you can go to. You have a choice before you. But you also want to get to an institution that brings out good provider outcomes. You yourselves, as you come out, are you happy to operate as doctors and to operate in those environments? And here, I think we would want really to talk more about healthcare providers who are well suited for environments where the populations are deprived. In Zambia, we talk of rural areas, and I think that's the same with many other countries. Does the institution bring out providers who are fit to operate in rural areas, in hard to reach areas, in areas where there may be scarcity, and so the doctor must learn to innovate, must learn to use initiative to get things done? Most of the institutions in Zambia now have been made to have what is called a community-based education. And that is really just aimed at introducing students to local communities, trying to prepare them for healthcare provision to those deprived populations. I really think a good medical school should be able to bring out health workers who are ready to operate in any situation, in any environment, and be happy to work there. And ultimately, we would want to say, how is this system set to make an improvement in system outcomes? Here we are talking about the healthcare system. Every country has a healthcare system, and we would want this healthcare system to keep improving with time. And you will be the additional doctor to come out of this system and make a difference to the healthcare system. Does the institution prepare you for that? Meaning that as you learn clinical medicine, you have to learn health administration as well. You have to learn public administration. You have to learn how the health system fits into the other systems. You have to learn, things such as, health economics. You have to learn health politics, okay? And in all, you must come out those big dictates that I've laid before you as being necessary for you making a choice about going to that particular university. There are particular details that you still need to get into. The first thing that you'd want to look at is really the education mission of the institution you want to go to. What is their education mission? Do they just want to teach people about medicine, or do they want to train people to become doctors? I really think that for the latter to be true of an institution, that institution must have what I've called here a tripartite mission. It must have a three-pronged approach to nurturing the students who are coming out of that institution. Better to learn. But yes, there must be these people who are placed within what we call administrative leadership, people who are put there to guide the students and to show them the corners of the profession, or the corners, especially when it comes to education, that these people who are geared towards showing them where they can get knowledge from, and people who can then show them how to utilize that knowledge to do what may be required within the health education field. So does that institution insist on having good teachers? Does it insist on having a good teaching curriculum? And does it actually deliver a good teaching curriculum? The next mission is that on research. For an institution to boast of having good teachers, those teachers must be actually deep in research. What type of research are they doing? And how do they make use of the research that they are doing? A medical school is really a hub of knowledge generation. But it is not enough that knowledge is generated. Knowledge must be applied. Knowledge must fit within the healthcare system to cause a change, either in policy or in clinical practice. That is what we call knowledge translation. So we are saying that, does this institution respect research? In saying, does it respect research, we are saying, does it really promote knowledge translation? Does it encourage its lecturers to make known the findings of their research? And do they interact with the system to make the system know what is being generated out of that research? And are we seeing changes in clinical practice because of the research that is going on? Are we seeing changes in health policy because of the research that is going on? I really think that that is one mission that must be respected. The third mission of a good medical school is service provision. And here we are talking mostly about healthcare service provision. How well has the institution placed itself to give access to patients for their students? And we are saying their students must really get to attend to patients in a good healthcare institution, meaning that there must be a good relationship between the education institution, which is the university we are talking about here, and the clinical sector, which is the hospital where the students will be going to do their practicals. And the university must actually be the one that sets standards on what would be called standard patient care. All right. And so we ought to have this tripartite mission clearly stated in the school's mission, but also being practiced. And so you, as a prospective student, should really be looking forward to getting your questions answered. Is teaching going on well? And is there research? And is the research going on well? Are we having a good hospital that is associated with our training program? And are we having good patient outcomes from that hospital? Yes, 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 you have an institution. Choose it, get in there, and please do your best to come out as a good doctor. And then we look at the individual lecturers who are placed before you, the professors who will be taking you through this whole process. Are they doing what is expected of them? Mostly the lecturers or the professors in a medical school will be both teachers, meaning that they are there to instruct, but they'll also be practitioners. They will be good clinicians. Because when we talk about medical education, we are really talking of issues that center on three things, I would say. First, of course, is the education, okay? That these people, the lecturers, will be able to take you through didactics. They have knowledge themselves which they would want to share with you, okay? They have access to good training facilities, and so they are able to utilize those facilities to guide you in your learning. These lecturers also ought to have the necessary tools that are required for teaching. They ought to have access to good laboratories. For basic sciences, it's a must that you must see phenomena that you must see scientific phenomena illustrated in a laboratory setting. So you need to have these laboratories. Get there, see what is happening, see the chemical reactions, see muscle twitches, see, drugs, kill those microbes and things like that. That must be demonstrated in a laboratory setting. Do these lecturers have access to such laboratories? If the answer is yes, they are doing one of the most important things, which is educating you. Okay. Apart from educating you, a good lecturer must play the role of being a good skills transfer person. He must have those key skills that are required in his particular field, and they must have the ability to transfer those skills, okay, to you. And you must also come out not only as good as they are, probably even better than they are. Medical education, there's a lot of skills transfer that takes place there. So those are the three things under education alone. Okay, but the second thing that I wanted to well, I think I did mention the second thing that a good member of the faculty is supposed to do. That's skills transfer. Okay, but the third thing is very important, and that's the thing about mentorship. Okay, a good lecturer must be a good mentor. He must be able to take you along and say, well, follow me because I am a good doctor, so to say. And so you must be able to walk in his ways. You must be able to share yourself with them. And this is one thing I think that has not changed from medieval times. Medicine has always been said to be an apprenticeship, has always been said to be something that takes place between a master and his a student, so to say. And in the early days, it used to be a one-to-one type of affair. But now we have several students crowding around just one teacher. But even in that crowd, a good lecturer must be able to take keen interest in each of you and be able to attend to you and be able to guide you along. And really, it's not really just teaching or skills development, but much more. It's mentorship, building you up to become a responsible person as he is, and teaching you to navigate through the health system the best way you can. And getting to my last slide now, and I hope we have questions that will lead us into into our next discussion. And this is now to say that as a student, really, you do not do well just to be looking at the institution where you'll be going to, okay? And you think that the institution will build you up into something that you want to become. You also ought to have your own personal ambition to become a doctor, meaning that you must have that purpose in mind. That is why I think we are insisting now in having a good selection criteria to make sure that those who are selected to do medicine are those who have medicine at heart. I know there are a lot of parents, I inclusive, who would want our children to become doctors. Okay? And when my firstborn son said no to medicine, it broke my heart. I was wondering, why doesn't this boy become a doctor? Is it because I'm a very bad father myself, or I've been a very bad example to him? But nay, he didn't want to become a doctor. And he did engineering, and he's very happy as an engineer. And I look at him now and say, well, could he have become a good doctor? The answer is no. And so I hope none of you is being pushed by your parents. Oh yeah, become a doctor, become a doctor. If it is not on your heart, please don't attempt, because you become a very bad doctor and people will blame the institution where you trained. So first of all, it must be in your own heart to become a good doctor. And so have that vision of becoming a good doctor. Then you can look for an institution where you are going to train. Apart from that, have a plan. How do you want to train? What type of doctor do you want to become? I like people who plan well. Say, well, I'm entering medical school, but really I want to become a neurosurgeon. Oh yeah, I'm getting into medical school. I would really want to become an orthopedic surgeon. Oh, I'm getting into medical school. I want to become a psychiatrist. Actually, that's a good plan, because once you plan like that, it helps you even choose an institution where you can go, an institution which has a huge portfolio that is within your field of interest. Then I would say be focused. As you plan to get into medical school, make sure that you are focused on doing medicine, and that your mind is not going to stray into other things. Well, see, counsel, and I think what we are doing this afternoon is that counsel, listen to people who have been through it. What do they think about medicine? Is it a good thing to do medicine? And how do I maneuver so that I can become a doctor? I can become a good doctor. Okay? So there's need for mentorship to start even at this time. Seek to get close to those who are within the field. Ask them those hard questions, and please be willing to be mentored. And as you go along, periodically reassess your decision. If you are sure that medicine is what you want to apply for, is what you want to study, being a doctor is what you want, then please go ahead, apply for admission, and apply to a good school. Thank you very much, ladies and gentlemen. I will now take a few questions. Thank you very much. All right, so probably I can make one comment. I've just realized here that I didn't mention, I think, one thing about choosing a good medical school. And that is the issue, I think, okay. And that is the issue of learning medicine. I think there are two ways in which we teach anatomy, especially. And there's a way in which, anatomy has evolved, and a lot of schools now are going towards using plasticated models, or just using pictures to teach anatomy. I really think that, the traditional method of teaching anatomy, teaching the human body, where you are actually having access to dissecting the body, is a better way of teaching anatomy than using plasticated models. So I think that's one other criteria that students ought to consider when they're choosing a medical school. They have to ask the medical school, how do you teach your anatomy? Do you have access to real cadavers, or do you teach on models? And I would say prefer those institutions which have access to cadavers, because then you learn real anatomy and you see structures in their natural environment, so to say. And so you tend to appreciate the structures better. And especially if you want to do surgery, I think you prepare yourself better that way. Well, I think Francis has said an important thing. First of all, that one who is aspiring to do medicine must be very strong at sciences. It's very, very important. There's a lot of mathematics throughout the career of medicine. There's a lot of physics, a lot of chemistry and biology. Very, very important. But apart from that, I think the other subjects also matter, so to say. You ought to enjoy an amount of history, because even in medicine, we do have history, okay, of medicine. And it just makes a lot of fun to consider historical facts sometimes. Geography is also good to know geography, because again, as I said, it teaches you how to map topography and how to relate to the world as a whole. And now, we are moving towards a lot of robotic surgery, and you would want to know who you are relating to and things like that. So arts are not really an exclusion. You don't have to exclude the arts completely. I think they also have a role to play. And so do bits of the arts as well, history, geography, and then we have other sciences as well. for us here, I think in terms of mathematics, we prefer that one does additional mathematics as well. It makes them perform better when they come to do their A levels, so to say. And so I really think that, for one to become a doctor, yes, you must be solid at the sciences, but also must have room for the other subjects that are art based. That name sounds very Zambian, and so I would be assuming that Chipego is in Zambia. I really want to say that first of all, it's good to study medicine in the environment where you're going to practice primarily. And so if your primary area of practice is Zambia, then study medicine in Zambia. That will give you a very, very good grounding to understanding the society, understanding sources of disease, understanding the disease pattern, and then you know what priorities there are for the health system. So it becomes easier for you to get into the health system. And so if you are in Zambia, study in Zambia, but go abroad for your postgraduate training. Okay. But even training in Zambia, medical training to a large extent is international medicine. And so the World Federation of Medical Education always tries to give guidance on what is baseline. So even if you study in Zambia, the medicine you study in Zambia is one that can be applied in America, it can be applied in UK, it can be applied in India, wherever else you'd want to practice. And so there's that internationalization to medicine. But while you are training, we also encourage students to go for what we call elective attachments, meaning that you spend 6 to 8 weeks at a different institution, trying to get to understand what they are doing and trying to understand how they are learning there. Okay, I trained in Zambia myself, but when I was doing my 6th year of our 7-year program, I spent some time at Nairobi University School of Medicine, and I learned quite some good parasitology there. I found some conditions existing in Kenya which didn't exist in Zambia, and that was very, very interesting to me. But my friends went to America. Someone went to Swaziland. Someone went to UK. Someone went to Australia, I think. You just scatter, okay? And then we also in Zambia get a lot of students from abroad. I think the ones who spend longest time are from Germany. I think they spent 3 months at School of Medicine. And now we are having some students from China who spend a whole year at our School of Medicine. And so there's this interaction which continues to happen, and it's a very, very healthy interaction. But to answer your question, your primary training must be in the environment where you intend to spend most of your time practicing. Well, I think as one gets into a medical career and goes through the different years, they find that actually their interests get cemented towards doing a particular thing. And so I don't think it's good to make a choice because everyone else is rushing for that particular specialty. No, I really think that you need to make a choice for what your heart tells you is the best for you. It may be something that nobody else wants to do, but really, if that is what makes you happiest, then go for it. The question of how it will be done is what gets answered as you discover which institutions to go to. I have done cardiology myself, but even my approach to cardiology has not been the way other cardiologists have approached it. My interest is more into what is called electrocardiology, and to do electrocardiology requires a lot more academia than clinical work. And so I had to do more academia than clinical work. And so I found myself doing a master's and then going on to do a PhD instead of getting on to do the Master of Medicine or going to do fellowships in cardiology. So these things actually fall into place as you progress. But all I would want to say is that to enjoy the practice of medicine, you need to go with your heart and not to go with the crowds, because whatever the crowd sees as lucrative may not be that which is going to please you. But do what your heart desires most, and as you practice, you will enjoy yourself. And the fields of specialization are many, and I really think that you just lose yourself in the whole mirror that is before you. So please get into medical school, and the rest will fall into place. All the best. I think this was our last question, and I would want to say thank you very much for having me, and I hope we'll continue to interact as days go by. Thank you very much, and bye-bye.
Thank you so much, Dr. Goma. It was really a helpful session. Thank you.
You're
I
welcome.
think I'll hand this over to Jeswin, who is a part of Texila, and he will close the session. Thank you.